Oh, and thank you for joining me for this very last video of the urinary system. We'll touch upon just a few examples of disorders as we're kind of completing the chapter material. And let's start with UTIs, so urinary tract infection. This is a general term for an infection in any part of the urinary system. And these often start when a bacteria gets into the urethra, so the tube through which the urine leaves the body. And most UTIs involve the lower urinary tract, so they impact either the bladder or the urethra. Some of the risk factors include being born female, using certain birth controls like diaphragms and spermicide, and if one has blockages in the urinary tract. And symptoms of the UTIs include, for example, strong urge to urinate that does not go away, a burning feeling while urinating, and also some signs that are common include, for example, urine that may look cloudy or red or bright pink or cola colored. In addition, it may have a strong odor. And another symptom that we would sometimes see is pain in the pelvis. Sometimes, however, UTIs cause no symptoms. So when it comes to the treatment, medicines like antibiotics are often used to fight these bacteria in the UTIs. In very serious cases, it may be necessary to give antibiotics through a vein. Pain medications may be used to help with the burning feeling while one is urinating. So that was our UTIs. Let's have a look of the next condition that we have listed, and that's going to be our kidney stones. These are hard deposits of minerals or acid salts that stick together in concentrated urine. And they can be painful when passing through the urinary tract, but usually do not cause any permanent damage. The most common symptom is severe pain, which is usually in the side of the abdomen. This can be associated also with nausea. The treatment includes pain relievers, drinking lots of waters to help to pass the stone, and medical procedures may also be needed to remove or break up larger stones. And then I thought that we were going to wrap up this recording by looking of the condition known as glomerulonephritis. This is a kidney disease that damages the glomeruli, which we just saw as these tiny filtering membranes that help to remove waste from the blood at the nephron level. And this disease can be caused by a number of factors, including viral infections, such as in case of HIV or hepatitis B or hepatitis C, or caused by bacterial infections. I think strep or staph are particularly good examples of that. Or it could be toxins or medicines that cause it. There's also lupus-related kidney inflammation that may be at play. So some of the symptoms that we can see here include, for example, blood in the urine, which can make it appear either pink or red or brown, or protein in the urine, which can make it appear foamy or bubbly, high blood pressure, or associated swelling, for example, in the face, eyes, ankles, feet, legs, or belly area. And it is also possible that there's this feeling of just generally being more tired than usually. And this could be either acute, so coming on suddenly, or chronic, so developing over several months to even years. And mild cases may not cause any noticeable symptoms and are often diagnosed during other blood or urine tests. And while most cases get better on their own, if it does not, there are treatments that can prevent further damage. And these include, for example, steroids or biological drugs or chemotherapy agents. In rare cases, a kidney transplant or mechanical blood filtering, so dialysis, may be needed. So that about wraps it up for this final video that we have for the urinary system. And as always, I look forward to working with you either in virtual spaces or in a classroom setting. So until we see next time, thank you for joining me and I'll see you there. Bye.